Alright, class, let's talk about glaucoma, a high-yield topic for your NCLEX exam. So, what exactly is glaucoma? Glaucoma is a group of eye conditions that are characterized by damage to the optic nerve, and that damage is primarily caused by increased intraocular pressure, or IOP. Over time, this leads to gradual and irreversible vision loss, and if it's not treated, it can result in permanent blindness. Now, let's go a bit deeper into the pathophysiology, which is commonly tested on the NCLEX. Here's how the normal process works. Aqueous humor, that's the fluid in the eye, is produced by the ciliary body. It flows forward through the anterior chamber of the eye. From there, it drains out through a special system, the trabecular meshwork, and then into the canal of Schlemm. But in glaucoma, this drainage system doesn't work properly. When that drainage is impaired, fluid begins to build up inside the eye. That buildup increases the intraocular pressure, which eventually leads to optic nerve damage. And that's what causes the progressive vision loss we see in glaucoma. Alright, now that we've built a solid understanding of what glaucoma is and how it develops inside the eye, let's take the next step and talk about something that often confuses students on the NCLEX, and that is the different types of glaucoma. Now, listen closely, because knowing the differences between the types is key to answering exam questions correctly. So, there are two major types of glaucoma that you need to be familiar with, and both show up frequently on the exam. Let's start with the first one, which is called open-angle glaucoma. This is actually the most common form of glaucoma. It's chronic, which means it develops over time, not suddenly. It's also painless, and because it progresses very slowly, patients often don't even realize they're losing their vision until it's quite advanced. So on the NCLEX, when you see the words chronic, painless, and gradual peripheral vision loss, you should be thinking open-angle glaucoma. That brings us to the second type, which is angle closure glaucoma. Now this one is very different and very serious. It comes on suddenly, which is why it's considered an acute condition. And here's something super important. It's a medical emergency. Unlike open-angle, angle closure glaucoma is painful, very painful, and requires immediate treatment to prevent permanent blindness. So just to help you contrast the two, open angle is slow, silent, and sneaky, whereas angle closure is fast, dramatic, and dangerous. Now, let's go a little deeper and talk about the clinical features because this is where NCLEX really likes to ask detailed questions. First, let's look at the symptoms of open angle glaucoma. As I mentioned earlier, it's painless, but it causes a gradual loss of peripheral vision. And what does that lead to? Tunnel vision, where patients can see straight ahead, but the sides start to fade away. Now, moving on to angle closure glaucoma, and this is where things escalate quickly. The clinical presentation is much more dramatic. Patients often report severe eye pain and not just discomfort. We're talking intense pain. They also experience blurred vision. One classic sign is seeing halos around lights. Many patients feel nauseous and may even vomit. When you assess the eyes, you'll notice a fixed mid-dilated pupil. It won't respond properly to light. And of course, there's often visible redness in the affected eye. So when you're answering NCLEX questions and you see a sudden, painful onset with these symptoms, think angle closure glaucoma. Let's move on to a very important part of your NCLEX prep, pharmacology for glaucoma. Let's begin with one of the most commonly tested classes, beta blockers. An example you'll definitely come across is timolol. So, how do beta blockers help in glaucoma? Well, they work by reducing the production of aqueous humor, and this directly helps in lowering intraocular pressure. But, and this is important, they're not safe for everyone. You must remember to avoid giving beta blockers to clients who have asthma, bradycardia, or heart block, because these medications can worsen those conditions and put the patient at serious risk. Now, here's a key nursing action that's often tested on the NCLEX. When administering beta blocker eye drops like timolol, make sure you apply punctal occlusion. That means pressing on the inner corner of the eye, the canthus, for 1 to 2 minutes after giving the drops. Why? This technique prevents systemic absorption, which can reduce side effects. Let's now move on to another major drug class, prostaglandin analogs, with latanoprost being a classic example. Unlike beta blockers, prostaglandin analogs work by increasing the outflow of aqueous humor, helping the fluid drain more efficiently from the eye. However, they do come with some unique side effects you need to educate your patient about. These include darkening of the iris and increased eyelash growth. These effects are not harmful but can be cosmetically noticeable, so it's important to counsel patients in advance. Next, we have alpha agonists such as brimonidine. This class of drugs does two things at once. It both reduces the production of aqueous humor and increases its outflow, making it very effective. Now, as the nurse, you'll want to tell your patient to watch for side effects like dry mouth and eye redness, which are quite common with brimonidine. Moving forward, let's talk about carbonic anhydrase inhibitors. And the name to know here is acetazolamide. These drugs also reduce the production of aqueous humor, just like beta blockers. But here's what makes them unique. They're usually given orally, and they are especially helpful in emergency situations, such as acute angle closure glaucoma. Let's continue to the next category, cholinergic agonists, like pilocarpine. Now, these medications are particularly useful in angle closure glaucoma because they work by constricting the pupil. This increases the outflow of fluid from the eye, relieving pressure. Finally, we reach the osmotic agents, which are used in critical situations. One of the most high-yield examples here is intravenous mannitol. It's used in acute angle closure glaucoma, especially when immediate reduction in intraocular pressure is needed. It acts rapidly to pull fluid from the eye and lower pressure, making it a go-to in urgent cases. All right, now let's shift our focus to a very important section for the NCLEX, your nursing responsibilities in glaucoma care. These aren't just textbook points, these are real actions you'll be taking as a nurse to protect your patient's vision and promote safety. So let's break them down one by one. And I'll explain why each one matters. First, always educate your patient on the importance of lifelong medication use. Why? Because glaucoma is not something that gets cured. It's managed over time. So patients need to know that skipping their eye drops isn't an option. It's a lifelong commitment. Next, you'll want to teach the correct technique for administering eye drops. And this step is often overlooked but super important. Remind them. Always wash your hands before using drops. Don't let the dropper touch the eye. And here's a critical one. Use punctal occlusion. That means gently pressing on the tear duct so the medication stays in the eye and doesn't drain into the system. Now, let's talk about medication safety. You should monitor for signs of toxicity, especially with medications like timolol, which is a beta blocker. What are you looking for? Things like bradycardia, vision changes, and a burning or stinging sensation. Those could be signs the medication isn't being tolerated well. Another responsibility is to measure intraocular pressure, IOP, regularly. This is typically done using tonometry, and it's how we assess if treatment is actually working. Without this, we're just guessing. Moving on, remember, avoid giving anticholinergic medications to glaucoma patients. These include drugs like atropine, which can worsen angle closure glaucoma. It's a critical NCLEX tip. And here's a big one. You have to be able to recognize the signs of an acute glaucoma crisis. If a patient is complaining of eye pain, seeing halos around lights, or experiencing nausea and vomiting, this is an emergency. These symptoms point to angle closure glaucoma, and you must act fast. Also, be sure to stress the importance of regular eye exams, particularly for patients over 40, those with a family history of glaucoma, or patients with diabetes. Early detection is key. For patients dealing with angle closure glaucoma, you'll also need to pay attention to positioning. The best position is semi-fowler. That's sitting at about a 30 to 45 degree angle. This helps reduce intraocular pressure. In addition, you'll want to monitor for systemic effects of medications, especially in older adults who are taking beta blockers. Remember, these eye drops can still affect the whole body. And let's not forget, if a patient reports eye pain during an emergency, always treat that as a priority. Sudden eye symptoms require immediate action. We're talking potential loss of vision if not addressed quickly. Also, when working with elderly patients or anyone with poor vision, use visual aids. Things like charts, labels, or even color coding can really help them stay on track with their medication. And finally, always notify the healthcare provider if the patient's symptoms worsen, especially if there are changes in vision or discomfort after starting a new medication. Now that we've covered the basics of glaucoma and its underlying pathophysiology, let's take a closer look at the surgical interventions used when medication and less invasive options are no longer effective in managing intraocular pressure. Let's begin with the first procedure, known as a trabeculectomy. In this surgical approach, the goal is to create a new drainage channel for aqueous humor. This channel helps divert fluid away from the natural, but now blocked, outflow pathway. ultimately reducing intraocular pressure and protecting the optic nerve from further damage. Moving on, another important intervention is laser iridotomy, which is commonly performed for angle closure glaucoma. In this procedure, a tiny hole is created in the iris using a laser. This new opening allows aqueous humor to flow more freely between the posterior and anterior chambers of the eye, relieving pressure and preventing sudden spikes in IOP. In some severe or uncontrolled cases, where both medications and initial surgeries have failed to maintain safe pressure levels, drainage implants may be considered. These implants are small devices that are surgically placed inside the eye to help regulate fluid outflow and keep intraocular pressure within a therapeutic range over the long term. Now, let's shift our focus to the post-operative nursing care, which is equally crucial in ensuring a successful recovery. First and foremost, patients must be instructed to avoid rubbing the eye under any circumstances. Rubbing can cause damage to the surgical site and increase the risk of complications such as infection or wound breakdown. Secondly, it's important that they avoid lifting heavy objects or performing activities that involve straining. This is because any increase in intra-abdominal or thoracic pressure can translate into elevated intraocular pressure, interfering with healing. In addition to these precautions, nurses must monitor closely for any signs of bleeding or infection at the surgical site. Redness, swelling, or discharge can indicate an early complication, and prompt recognition is key to preventing further issues. Lastly, nurses should ensure that all post-operative medications are administered exactly as prescribed. These typically include antibiotic eye drops, anti-inflammatory medications, and intraocular pressure-lowering agents, all essential to minimize inflammation, control pressure, and support optimal healing. All right, now let's move forward and talk about some NCLEX tips and key differences you need to be absolutely clear about when it comes to glaucoma. First, let's start with angle closure glaucoma. This is not something you take lightly. It's a medical emergency. The symptoms usually come on suddenly. The patient may report intense eye pain, may say they're seeing halos around lights, and can even experience nausea and vomiting. So what do you do in this case? The priority intervention is to give intravenous mannitol. That's a medication used to quickly reduce intraocular pressure and prevent further damage to the optic nerve. Now, let's compare that to open-angle glaucoma. Unlike angle closure, this one is much more chronic and it develops slowly over time. What's tricky is that it's often painless. So many patients don't even realize they're losing vision, especially peripheral vision. That's why we call it the silent thief of sight. Moving on to treatment, one of the most commonly used medications is a beta blocker eye drop, like timolol. These help reduce intraocular pressure. But here's something super important to remember. They need to be used with caution in patients who have asthma or any reactive airway disease. Why? Because beta blockers can cause bronchospasm, which could be dangerous for someone with compromised respiratory function. Now, another NCLEX favorite, and something you should definitely remember, is this: glaucoma medications should never be stopped abruptly. If a patient discontinues their drops without medical supervision, their intraocular pressure can spike very quickly, which can lead to sudden vision loss. Also, keep in mind that eye drops for glaucoma are typically prescribed multiple times a day, and that means patient education is essential. You need to emphasize how important it is to stick to the schedule and not miss doses. And finally, if a patient is prescribed more than one type of eye drop, always remind them to wait at least 5 minutes between each medication. This ensures proper absorption and prevents the second drop from flushing out the first one, a very easy mistake that can reduce the effectiveness of treatment. Now we will discuss the important questions related to glaucoma. Let's begin with Question 1. A client with newly diagnosed open-angle glaucoma is prescribed timolol Maylete ophthalmic drops. Now, let's look at what the client says. Which of the following client statements indicates a need for further teaching? A. I will apply pressure to the inner corner of my eye after administration. B. I will avoid using the medication if I have a cold. C. I will use the drops exactly as prescribed, even if my vision seems fine. D. I should not suddenly stop using this medication. Let's see which option is correct here.
The correct answer is B. I will avoid using the medication if I have a cold.
Now, let me explain why this is the correct answer. Timolol is a topical beta blocker used to reduce intraocular pressure in glaucoma. Having a cold doesn't interfere with its use, Avoiding the medication during a cold could lead to poorly controlled intraocular pressure, which is dangerous. The other options demonstrate good understanding. Applying pressure to the inner eye corner, punctal occlusion, is correct. It helps reduce systemic absorption. Continuing medication even when asymptomatic and avoiding abrupt withdrawal are both key teaching points. Let's move on to question 2. Which of the following clinical manifestations would the nurse most likely observe in a client with acute angle closure glaucoma? A. Gradual loss of peripheral vision. B. Severe eye pain with halos around lights. C. Sudden onset of double vision. D. Purulent discharge and red sclera. Now, which one do you think best reflects angle closure glaucoma? The correct answer is B. Severe eye pain with halos around lights. Here's the rationale. Acute angle closure glaucoma presents suddenly and dramatically. It is considered an ophthalmologic emergency. Patients typically report severe eye pain, blurred vision, headache, nausea, vomiting, and seeing halos around lights. This contrasts with open-angle glaucoma, which is chronic and painless with slow peripheral vision loss. Options C and D point more toward neurological issues or infections like conjunctivitis. Let's take a look at question 3. A nurse is administering pilocarpine eye drops to a client with glaucoma. What is the therapeutic purpose of this medication? A. Increase aqueous humor production. B. Constrict the pupil and enhance outflow of aqueous humor. C. Dilate the pupil and improve vision clarity. D. Block beta-adrenergic receptors to reduce tear production. Let's break it down. Which mechanism matches pilocarpine's function? The correct answer is B. Constrict the pupil and enhance outflow of aqueous humor. Here's why. Pilocarpine is a cholinergic agonist that works by constricting the pupil, miosis, which opens the trabecular meshwork and promotes drainage of aqueous humor, a key treatment mechanism for open-angle glaucoma. It doesn't increase fluid production or dilate the pupil. In fact, dilation can worsen angle closure glaucoma. Ready for question 4? Let's go. This one involves discharge teaching, another high-yield NCLEX theme. The nurse is reinforcing discharge teaching with a client who has open-angle glaucoma. Which statement by the client indicates correct understanding? A. Glaucoma can be cured if I take my medications. B. I will take my medications even if I don't have symptoms. C. I will stop my drops if I develop a headache. D. I will avoid all physical activity to protect my vision. Which one shows that the client has truly understood the teaching? The correct answer is B. I will take my medications even if I don't have symptoms. Now let's talk about the rationale. Open-angle glaucoma is chronic and often symptomless in the early stages. That's why adherence to medication is critical. It's not curable, but progression can be slowed. Headaches may be a side effect, but stopping medication without medical advice is dangerous. And there's no need to completely avoid physical activity. Only activities that increase intraocular pressure should be limited. Now, let's move on to our next one for now. Which of the following medications is contraindicated in clients with narrow-angle glaucoma? A. Atropine. B. Timolol. C. Latanoprost. D. Dorzolamide. Which option poses the greatest risk in this condition? The correct answer is A. Atropine. Let's explain why. Atropine is an anticholinergic agent that causes pupil dilation, mydriasis, which can worsen or trigger an angle closure event in individuals with narrow-angle glaucoma. The other medications, timolol, latanoprost, and dorzolamide, are commonly used to manage intraocular pressure in various types of glaucoma. Let's move on to question 6. Which nursing action is most appropriate when administering multiple ophthalmic medications to a client with glaucoma? Now, let's look at the options. A. Administer all drops quickly to avoid contamination. B. Wait 5 minutes between administering different eye drops. C. Instruct the client to blink repeatedly after each drop. D. Administer medications directly onto the cornea for best absorption. So, which of these is the most appropriate nursing action? The correct answer is B. Wait 5 minutes between administering different eye drops. Here's the rationale. When multiple eye drops are prescribed, they need to be spaced apart by at least 5 minutes. This prevents one medication from diluting or washing away the other, ensuring maximum absorption. Now, let's clarify the incorrect options. Option A may seem efficient, but administering drops back-to-back increases overflow and cross-contamination. Option C, blinking repeatedly, can actually expel the medication. And option D, applying drops directly to the cornea, is incorrect because it can cause irritation. The drops should be placed in the lower conjunctival sac. Now moving to question 7. A client with glaucoma is scheduled for a trabeculectomy. What is the primary goal of the surgical procedure? Let's explore the answer choices. A. Restore lost vision by regenerating optic nerve fibers. B. Improve the drainage of aqueous humor to lower intraocular pressure. C. Remove the lens to reduce eye pressure. Decrease systemic fluid volume to reduce ocular fluid. So, which one is correct? The correct answer is B. Improve the drainage of aqueous humor to lower intraocular pressure. Why is this correct? Trabeculectomy is a surgical intervention for glaucoma where a new drainage channel is created to allow aqueous humor to escape the eye. This reduces intraocular pressure, IOP, helping prevent further optic nerve damage. Now let's quickly eliminate the distractors. Option A is incorrect. Once vision is lost due to nerve damage, it cannot be regenerated. Option C refers to cataract surgery, not glaucoma. Option D, reducing systemic fluid, is not the goal of this procedure. All right, let's now move on to question 8. Which nursing intervention is most important post-operatively for a client who underwent trabeculectomy for glaucoma? Here are your options. A. Apply pressure dressing over the eye. B. Encourage coughing and deep breathing. Check monitor for signs of hemorrhage or vision changes. D. Administer high-dose corticosteroids. IV. Let's determine the best nursing action here. The correct answer is C. Monitor for signs of hemorrhage or vision changes. Here is rationale. Following glaucoma surgery, one of the top priorities is monitoring for complications like bleeding, infection, or hypotony. Low intraocular pressure. Vision changes may signal a serious issue and should be reported immediately. Option A, pressure dressing, is contraindicated because it may raise IOP. Option B, coughing, should be avoided for the same reason. Option D, high-dose corticosteroids, is not typically required unless prescribed for inflammation, and usually it's in the form of drops. Let's continue with question 9. This one tests your understanding of risk factors. Which client is at highest risk for developing primary open-angle glaucoma? Your options are A. A 60-year-old Asian male with a history of sinusitis. B. A 45-year-old Caucasian woman who smokes. C. A 65-year-old African-American woman with diabetes. D. A 50-year-old Native American male with seasonal allergies. Let's pick the most appropriate answer here. The correct answer is C. A 65-year-old African-American woman with diabetes. Here's why. Primary open-angle glaucoma has some well-established risk factors: being over the age of 60, having a family history, being African-American, and having diabetes. All of these risk factors are present in this client. The other options may include some health concerns, but none are strongly linked to open-angle glaucoma. And finally, question 10. This one focuses on patient education and prevention. During a health fair, a client asks the nurse how to reduce their risk of glaucoma. Which is the best response? Let's go through the options. A. Drink more water to reduce pressure inside your eyes. B. Avoid reading in dim light to protect your vision. C. Schedule regular eye exams, especially if you have risk factors. D. Use sunglasses to reduce eye strain. Which advice is most evidence-based? The correct answer is C. Schedule regular eye exams, especially if you have risk factors. Open-angle glaucoma often progresses silently, and by the time symptoms are noticeable, significant optic nerve damage may have already occurred. Regular comprehensive eye exams with tonometry and optic nerve checks are the gold standard for early detection. Options A, B, and D reflect common myths or general eye health tips, but do not help in reducing glaucoma risk specifically. Thank you for watching this video. Stay tuned for more videos.